congress, and then we do plantar testing. We find out how much pressure is coming on the hind foot, on the middle of the foot, or in the forepart of the foot. And these are the areas where if we do the gait analysis, we see that when the patient is walking, he walks in the toe of face to the heel of face, and in this, how much pressure is coming on the hind foot, even on the middle of the foot or on the front part of the feet, and that relieves the pressure. Suppose an ulcer is there under the first metatarsal husk, so we have to devise a way to reduce the body pressure or a foot pressure which is coming over this area, or even in a midfoot ulcer or a Charcot's ulcer, we need to devise a way to reduce pressure or remove the pressure from this area, then only these ulcers heal. And we have to also think of newer antibiotics, because most of the time these ulcers, they get resistance develop, because by the time they come to the tertiary center, a lot of primary antibiotics are being given to them, and a lot of good antibiotics are available now. Rather than giving antibiotic, the main course on diabetic wound management is that we need to do a thorough debridement. Debridement is a part and parcel of a wound care management technique. If we can do a proper debridement, I assure you these wounds heal very well. Among debridement, there is a new technique which is known as ultrasonic debridement by a company called Suri, for which Overseas Associates is participating in our congress as a principal sponsors. And what they do is, it is an ultrasonic jet massage which occurs on the wound. Suppose a wound is there and there is an ultrasonic probe which goes all along the wound, and it removes the slough, even the biofilm or the necrotic tissue from the surface of the wound. And what we see within the second or third sitting, good granulation tissue formation is there on the wound. And ultrasonic debridement is a very good technique to remove slough even from the cavitatory wound. Suppose the cavities are there even in the middle part of the foot or at the periphery of the wound, so we can remove the slough, and good granulation tissue formation occurs, and later on we can graft these wounds. One of the foremost and other things is that PBK therapy. They are also participating in our congress. It is electrical stimulation of the peripheral vessels, and data shows that when we apply these pads, this invention has been done in Italy, for which Dr. Lazzaro is there to present a paper on this technique. And we are doing on our patients, and we have done something around 60 to 70 patients in last about 8 months. And I mind you, very excellent results, good results we have seen in our patients. What it does is that it releases nitric oxide and vascular endothelial growth factors from the wounds and in the peripheral legs, and it increases the blood circulation to the wounds, for which this early granulation tissue formation and even epithelialization occurs on the wound. We were initiated with Cipla Life Care, and we are thankful to them for this initiative which they have taken to increase awareness, because a lot of awareness needs to be generated among our medical professionals, among our doctor friends, so that we come together, we make more foot clinics, and we develop more foot clinics and diabetic wound management protocols. We are in the process of developing a protocolized treatment for wound management for diabetic ulcers, whether being diabetic wounds or venous ulcers or trophic ulcers, even for the gangrenous foot or ischemic foot with peripheral neuropathy. And a special type of offloading shoes or a simple preventive footwear is very important. There is a lot of dearth in our country for this preventive footwear. A lot of patients ask us what type of footwear to take or where to go for the footwear. So these are all the modalities we have been working under IPA to bring them together and generate awareness about disease. Another very important thing is new dressings. This is very important. Sometimes we also don't know that what type of wound, when we see a wound, what type of dressing has to be applied on the wound. So a new dressing material like honey dressing, collagens, then we have sea sops, then we have alginate dressings. So a lot of things are available in our country. A lot of awareness is being generated, but we all have to work together under the banner of Indian Podiatry Association, for which we are here collected today. And we are proud to say that we have more than 450 registrations for a single day conference, and we'll try our best to generate and let people know what are the new treatment modalities. We have new techniques called stem cells. We have been working on stem cells. We have done something around 10 to 15 patients on wound management with stem cells. We are taking a bone marrow stimulation, even a mesenchymal cells, for which 2 companies, BK Biotech and International Stem Cells, is available. They are participating in this congress, and let's see how things will move from there. And we need to educate people and generate awareness about foot care, so that we can reduce the number of amputations, which is vastly high in our country. Thank you so much.